My name is Ewan Galbraith. I work for the Refugee Council as the independent unaccompanied asylum seeking child support service area lead in Yorkshire. And I was one of the trainers on the AMORAY pilot program. I've been working with young migrants and asylum seekers for about 7 or 8 years now. My first role was as like a more traditional support worker, so helping with very practical things like, well, I was supporting young people where they lived. And so it was a lot about cooking and cleaning and how to buy food and how to navigate the buses and getting registered at dentists and opticians and budgeting and getting to appointments and stuff. And then I got my position at Refugee Council, where I am now, and that was a lot more support with the asylum process and making sure people had legal representation and understood systems, understood what their rights and entitlements were from social care, and supporting them to access those. So it was so I've had quite a well-rounded experience, that more like practical side, and then more like looking at some of these systems like the asylum process. One of the most valuable for me was the whole risk assessment module, because it's helped me think about something that I sort of do in just like kind of an intuitive way, but much more like this is a model or this is a tool you can use for actually assessing all the risk factors and all the vulnerability factors and all the preventative factors and stuff. And I just think that was a good thing to learn about, and particularly stuff to do around suicide, which is a really like challenging topic, knowing how to respond when people talk about, you know, having thoughts about taking their own lives and stuff. And that, again, there are some really practical checklists you can check on there where like and questions you can ask people to determine basically what you should do. A few, to be honest. Depending on the module, I definitely always had cases that popped into my mind as being quite relevant. So I was working at the time with a girl who was trying to reunite with younger siblings from who were in quite a dangerous situation, and so she was dealing with a lot of uncertainty, a lot of stress, and it was affecting her behavior quite a bit. She was being quite like erratic, like trying to call me at all hours and sending long messages all the time and stuff. And so I was just reflecting on how some of these stresses could be like affecting her behavior, how I could deal with it better. I also had a young man who sadly did take his own life quite a while after I'd worked with him, but it did make me think about if there was any early signs or if there could have been more like thought about preventative factors. I feel like the modules, like the format is quite good. Like the 5 modules do kind of cover kind of the whole spectrum of mental health things without getting into like really like, you know, you need to be a trained therapist to like know these. So I think for like frontline workers, which is what it's for, like I actually think it covers the spectrum really well.